Okay, guys, we're going to get started. I will start with introductions. My name is Holly Farbo. I am the lead academic and industry relations manager for Hygiene. I am a hygienist. I've been a hygienist for 21 years. I worked in private practice for 19 of those years. And then I went to an Aspen Dental, and it was the best job of my career that I just loved everything about it. Which led me to this job. Basically, my job is to talk to students, to give them information about Aspen and let them know what a career at Aspen is like for them. So it's really nice to be able to get to the students and give them information and tell them my story about how I got to Aspen. So we'll go ahead and start with Raina. We'll go across here. And then we'll start with questions. Okay, we're going to go ahead and introduce yourself and tell us how you got to Aspen.
Sure. Hi, everybody. My name is Rena Khalil. I've been a Team HS, so basically that's a territorial manager of hygiene support with Aspen Dental. I started 11 years ago, and when I started right out of hygiene school, going just like you may be right now, super anxious, trying to get into the work field, trying to figure out what would best fit exactly what I want to do. And I stumbled across Aspen Dental. There was one opening right by my house, and I went in for an interview. And honestly, I could say that it was also my best decision of my life. I haven't had another job after that. I'm not looking for another job after this. I started off as a hygienist for the first 8 years. And then after that, I had a career opportunity to become a regional hygiene support system for hygienists, not just ones that just come out of school, but also seniored ones. So my job basically is to make sure that I'm there for support for you, both clinically and also as you're embarking on this new adventure of school. So I really enjoyed it. I've been doing it for the past few years, this specific position. And I think that's one great thing is between Holly and myself already, you can notice that we started off in one career and it led us to another career. So that kind of just shows you the world of opportunity there is.
Absolutely. Thank you. Katie, go ahead and introduce yourself and tell us how you got to Aspen.
Hi, my name's Katie. I work in the Chambersburg, PA office. I actually graduated in 2015, so I'm working on 5 years. I started out in private practice, just trying to scramble my whole schedule together. I started working in 4 different offices, 5 days a week, which was crazy. And then I stumbled upon Aspen Dental, which was exactly like Rena said. It was 5 minutes from my house. I was like, oh my goodness. And I applied. I actually started out and my office wasn't even open yet. It was completely just in the works. So I interviewed at an office about an hour and a half away from me. And I took the position with my job still unclear. So I actually worked in the Hanover office for about 6 months. And then for about 4 more months, I worked in the Mechanicsburg office, which are both, a little ways from my house. But I knew whenever I started with Aspen Dental that it was the career choice for me. I felt like I was right at home, no matter which office I was in. And as soon as I got to my home office, it just fit me completely. I could finally say, Mr. Smith, how are you today, every 6 months instead of jumping from office to office. And I just love every minute of it.
Great. Thank you. So you might see me looking over here. I have questions that people have asked either beforehand or asked during. So I'll be looking back and forth. So I'm going to try to gear the questions towards whoever I feel is should answer, or you both can answer, or whatever. It's very casual. So, just speak up. And at the end, if there's anything that we haven't gotten to, I'll give you a chance to kind of go over everything. So the first question is going to be, and this is a question that I get all the time from dental hygiene students. They are extremely scared to walk into an office and have a full schedule of patients. They always say to me, do I have to walk in and see, 8 or 10 patients? So, Katie, let me ask you this question. do you have a quota of patients that you have to see per day, and how does that go?
So no, I don't have a quota or anything per day. So what I've learned most from Rena is to work your own schedule. So especially when you're new and you have no idea what you were doing, because that's exactly where I was. I had no idea. Even going to Aspen, I was still new and had no idea what to expect. There isn't a set amount, and your team becomes your new family. So your office manager is your one to go to work with, to figure out what best suits you. So
Good. So, Rena, I'm going to give this question to you. What kind of training or mentorship is offered for not just a new graduate, but a new hire? Oh, you're not. I can't hear you.
Can you hear me now?
Yep, there
You go. So we have to offer as an onboarding program. So it's a 2-week training period. So prior to COVID, what happened was we would train for 2 weeks in the office, and then we would later get sent to Chicago or to Syracuse to our training base, and we would go a little bit more in depth there. So what they did is really awesome now is they combine those two things in one. So now with the restriction of air travel and everything that's going on, we try to be creative and think of a way that, you know, we can combine 2 trainings and make it as convenient for the hygienist. Katie actually is one of my trainers. So she had the experience, I think it was about a week or 2 ago, starting this new program that we rolled out. So you would never have to feel that you're coming out of school, or even as a new hire from one practice to another, if it may be private to a DSO or out of school to a DSO, never feel that you're not getting the proper training. That's exactly what we're here for. You'll be set up with a trainer that specifically knows how to go through the training process with you every step of the way. You would have me as a resource as well if you had any questions. But honestly, the best feedback I can say is I onboarded a lot of students this month right out of school, and everyone has said to me that they felt like they weren't just thrown into the wolves. They weren't just like, hey, figure it out. Here's a scaler. Good luck. Here's every half hour. And, you know, the best to you. We don't do that. A, we want to make sure you have enough timing. And B, we want to make sure that you know and feel comfortable day one when you're coming in. So we have 2 weeks of onboarding and training.
Great. So that was, honestly, I was a hygienist for 19 years. And when I came on, I felt like I had to, like, I lost a lot of my skills because I felt like I wasn't able to treatment plan like I should have in a lot of my private practices. So I needed that training just as much as a new hire. And it was wonderful. You know, I felt very comfortable going into that. Real quick, and I usually do this first, and I honestly forgot, but let me just explain for anybody that doesn't know what a DSO is. That way I can just, you know, DSO, we use that a lot. People say corporate, and, you know, that's just, it's a very cold word, and we don't like it because we're very, you know, we're a family. So a DSO is basically a dental support or dental service organization. And basically what that does is myself, I work for Aspen Dental Management. So there are two sides. There's the management side, and then there's the dental offices. The dental offices, we want the dentist and the hygienist to be able to work with treatment and not have to worry, treat the patient first. We don't want them to have to worry about marketing and, you know, getting patients and all of that stuff. So we do all that management side on the side, so the dentist and the hygienist can work on treatment. So if a new dentist walked out of school, he or she would have to set up an office. They would have to find a place for their office. So you'd need a real estate agent. They would have to set up their software. They would have to get a payroll system, you know, hiring and firing and marketing their business. And, you know, if their business wasn't doing well, they would probably hire some sort of a partner for business. And so all of those things we do on the ADMI side. So the dentist and the hygienist can focus on patients. So that's what a dental service organization is. Okay, so Katie, do you have 1 or 2 hygienists in your office or more?
I am actually the only hygienist in my office.
Okay, good. So what is an average day like for you? Take me through your average day.
Average day, coming in and meeting with the team. A lot of the times we will have like a meeting huddle in the morning to kind of go over our day and what there is involved in it. So we might, if there's any kind of handoffs or anything as far as between the doctor and the hygienist, if there's any kind of area that we can improve on. If, lately my schedule has actually been pretty open, so allowing us to kind of brainstorm a little bit of, if the doctor has a patient in her schedule that I could see, if I have some free time, which new patients I can see. But basically my day consists of scaling teeth. I see typically around 8 to 10 patients a day, plus I go into new patients to give them the education that they need to be able to understand their treatment whenever they come in for that appointment.
Good. So Rena, explain a little bit about how a two hygienist office works.
Sure, and that's exactly what we're trying to get for Katie in Chambersburg right now. We do have a job rec open. To answer your question, if you had a single or double, we do have single now, but we're definitely in the space right now where we can definitely support two, and that's ideally what we want to do in every office. We want to have two, not only to support our patients and have better access of care to them, but at the same time to give support to the hygienist. For some reason you're running behind, or for some reason you're not feeling well and you can't come in, you have the support of having a hygienist next to you that can jump in when needed. So that is our ideal situation, as having two. But how that typically goes, it can, if in most of the office where you do have something called the lead and associate role. So basically a lead role is a hygienist that's been there typically a little longer. She's really helping running the hygiene business. Basically what that means is calling and confirming the patients, making sure that the patients are okay, going in to see those new patients, like Katie said, really getting them to understand and feel supported about their education. So they understand why they need it. Not, hey, you need this, and we'll see you right now. We have to explain why they need it and make them feel comfortable, because most of those patients are the ones that have fear when they come to the dental office. So we want to make sure that we're alleviating that and definitely breaking down any barriers for us to kind of get to them and talk to them about that stuff. And then we have an associate role with maybe a newer hygienist at a school, or just even a second hygienist that's going to be working the actual schedule. Typically, we have about an hour for every appointment. So that will give you time just basically in that hour to see your patient. And I'm sure, Holly, you're going to kind of go into that later on. I have a feeling that's the question coming up, but it is a little different than let's say a private office where you have an hour to do everything. Basically you're getting that hour just to do the hygiene piece. So while one hygienist is concentrating on that, the other hygienist is going and seeing those new patients and maybe breaking down and setting up the rooms, and you're really basically working as a team, a team effort, and whatever someone needs is where you're going to help in.
Right. Okay, so Katie, Rena mentioned this about how we do things a little bit differently, and which is one of the things that I really loved about Aspen is how they see their new patients. So can you explain a little bit about what's the difference? Instead of a new patient coming in, they get their x-rays, they do an exam, we clean their teeth like that in a private practice. What do we do differently with our new patients at Aspen?
So at Aspen, it's a little bit different. We actually do all of our comprehensive care and everything first. So they get their comprehensive exam, then they get their x-rays, and we go in as hygienists to, we go in as hygienists to do our perio charting. So that way we know exactly what kind of cleaning that they need. We go over in detail what kind of tools that they need at,
Okay.
what tools that they need as far as take-home products, if they need anything that's going to make their mouth better, as well as go over, any kind of disease. So if they have gingivitis, if they have perio, we want to go over in detail with them about what they need.
I can kind of take a little over here too.
Yeah, go ahead.
Sorry.
Kate.
It's
Yeah,
okay.
that's okay,
It happens.
Katie. Hey, yeah. Let Rena go ahead. Go ahead.
So
Sorry.
no, and actually I want to speak on this piece because this is something that I actually speak about a lot when I do my interviews, and I want to establish a difference because I absolutely agree with you, Holly. This is, to me, the biggest factor that separates us from something that you may see in a private practice. And I think that rocks because usually, as hygienists, in 1 hour, you're seeing a new patient and you're doing the full mouth x-rays. And then you're also charting with the doctor. And then after that charting with the doctor, you're also doing the cleaning. And I always say this to my hygienists that are coming on board, we take disease really seriously.
Yeah.
So we're not going to do a regular prophy on something that needs a scaling and root planing. We're not going to do anything to risk our patients and risk our own license. So this really gives us time to just have our schedule of just hygiene. So we're not rushing through that hour and just doing a regular cleaning and passing it on. So like Kitty said, when a new patient comes in and checks in, a dental assistant is taking their full mouth x-rays. And when the dental assistant is taking their full mouth x-rays, they're the one charting with the doctor. We are stepping away to see this patient and educate them on hygiene and doing their perio charting. But when they're done, they're going to sit with a consultation, someone to do their consultation. And after they commit to treatment and go over insurances and whatever it is, if we have time in our schedule, we will see that patient. If we do not have time in our schedule, we have our own schedule that they will get scheduled into. So for example, if you're going into the office, you can not only take a look at what your schedule looks like tomorrow, but you can look at what it is next week and next month and next, 6 months from now. It's very organized. And I think that's really important because for me as a hygienist, when I was coming out of school, I wanted everything to be black and white as possible. I want to know what I have, how long I have for it. Can I pre-set up the room? I always wanted to be prepared, and nothing was kind of thrown in my way. The only thing that would new is, if you don't have anybody in your schedule, then we obviously want to give that access to care to our patients that are there. So, but yeah, no, I was happy to touch on that because that's one thing when everyone joins a team, they're like, I love this. I love that I'm just concentrating on hygiene. I'm not taking full mouth series and charting all the fillings with the doctors and all that kind of stuff. And they're just focusing on their career.
And so I like to bring that up because when people say that you have the schedule of your patients and then new patients, a lot of people will say, how do you juggle that? And so it's the thing about it is like you said, you don't have that you have a new patient coming in and you're expected to do their x-rays and clean their teeth and then the doctor sees them. That's not the progression it should be, because what if they do have disease? Now you've given them a regular cleaning and they don't feel like they need to come back. Now you're going to tell them they have disease process going on. It's kind of backwards away. And as far as my own personal, I've always done at private practice. So it's great there. So here's a question I always get. Do you have to sell? Okay. So a lot of people think that, if you work for a DSO, that you're selling products and you're a salesperson. So Katie, do you want to talk about the products that we use and how you approach those and why you give them?
Exactly. Yes. I never, ever, ever feel like I'm selling a product. I feel like when I was in private practice, you had nothing to give the patient. When they had sensitivity or, something that they had going on, you didn't have any products to give them. Now I have a full stock of everything that I need. So that patient can go home with the exact products that they need to help with the disease that they have. So with a lot of patients, what's pretty standard is for like a gingivitis or an SRP, they will get a chlorhexidine rinse, obviously to help, kill the bad bacteria that's in their mouth. To help with inflammation, things like that. 1.1 gel, which is like a Prevenant or a form of toothpaste to help with any kind of sensitivity or if they're a high caries risk. We also have MI paste, which I like to give to patients a lot because if someone comes in with any kind of white spots or sensitivity or dry mouth, I know that a lot of offices don't use this, but I use it on the regular, is actually the dry mouth gel. And that has had great success with patients that, you know, any kind of xerostomia from medications or things like that, that it's really easy to apply and it helps them. And then the biggest key factor that I feel like any new hygienist comes in and they're like, how am I going to sell an Oral-B to patients? That is my favorite topic of all because I love the Oral-B. I can easily talk to patients for hours about why they need to have an electric toothbrush versus a manual because it gets the plaque so much better. And honestly, I am not against any kind of judgment of Philips or anything, but I am so much prone to Oral-B because of the round brush head, and I can easily explain that to patients, and it's not a selling factor, it's just what I believe in.
Yeah. And I always recommended the Oral-B. And like you said, it's so nice to have those products on hand because these were products that I recommended to my patients anyway. And I would just leave it to them to go outside and try to find it. I mean, patients have a low dental IQ. They don't understand. I mean, even a general toothpaste, I would have patients come back and say, where did you say that you could find that? And so to try to explain to them what it is, but if you have it right there, and, you know, we're the number 2 on Henry Schein. We're their number 2 customer, right behind the United States government. And so they supply us more products so we can get really great deals on those things. So that's another great thing. So Rena, can you talk a little bit about compensation? That's always a question, of course, you know, the elephant in the room. How much do you make, or are you commission? How much do you have to sell to get a paycheck? So can you explain that a little bit on how compensation works?
Sure. And obviously this varies from area to area.
Right.
So I myself have 12 offices and all in different types of areas from Philadelphia to Allentown, Pennsylvania. The cost of living is obviously greatly different in those areas. So coming out of school, honestly, I can say that, you know, our hourly rate is very fair and very competitive with everybody else. We understand that the times have changed. We understand, you know, that hygienists aren't just, you know, popping up everywhere. We want to make sure that you're happy. We never want you to join the team and ever feel like, you know, you could have got better from somewhere else, or you felt like, you know, this wasn't the best decision that you've ever made. I feel like as a hygienist, and as a position that I am right now, you always want to feel secure in your hourly rate. I think that when my hygienists have these conversations with me, if they're already on and they're looking to, you know, be challenged and look for a higher rate later down the road, or even joining the team, I'm very open on this kind of subject. We obviously have to be realistic for the area, but at the same time, I think, you know, we're definitely in line, equally, if not a little above other areas as well. And then on top of that, you obviously have an opportunity as well to make a monthly incentive. And how this monthly incentive works is it's based on your mentality that we're trying to get our hygienists to really run their business like it's their own, right? Just like you're the doctor in the office of the doctor of hygiene, basically. So as you're going in and you're seeing your patients, how to manage your expenses and, you know, managing your schedule and trying to make sure that, you know, you have everything perfectly in line and getting used to your actual hygiene business to really succeed. So a lot of my hygienists actually make a monthly incentive on consecutive months on top of that hourly rate. The reason why we really want to secure you on your hourly rate is, like any incentive in any other business, it's not guaranteed every single month. So I know a lot of people rely on that hourly rate. So we want to make sure we're very fair and equal with that. And then whatever you make on top for that monthly incentive is just an extra bonus.
Yeah, great. For Kitty, for your new patients, what types of, I guess what I'm getting at is, do you have an iTero machine? You don't?
I actually don't. No,
Okay.
not in my office.
But do you use the intraoral camera?
We don't have one of those either.
Okay. Rena.
I have used them though.
Mm-hmm.
Yes. Do you have offices that have the iTero machine?
Yes, I have a lot of them. Yep.
Can you just really quick explain that to me and what that dental health scan is about?
Sure. The dental health scan that we do in the offices by the iTero machine is basically an opportunity for our hygienists to be able to educate and have a visual behind things. So not only do we offer Invisalign in the offices that carry the iTero, so we are getting into the orthodontics field and trying to let our patients experience that Invisalign smile, but at the same time, these dental health scans are really great and key when it comes to hygiene recommendations. I can't tell you how many times I've scanned and there's crowding in section 5 and there's that tartar in section 5, and no matter what you say, they're just not getting it until you scan it and they see it all on there. And you know, as new students, you probably may really realize this, that when you're in school we use the intraoral camera, and it's really great to have, you know, this advantage of having this technology in the office because we can show them instead of just hearing it. Not only hygiene, these intraoral cameras, basically these dental health scans, are showing them that one tooth in the back that's pretty brown or it has a hole in it. Oh my God, I didn't even notice that. I didn't even feel it. So they start to self-diagnose themselves. So they'll say like, oh my God, and look at that. Oh my God, and what's all that? That's what you're talking about. That's a bacteria. So it starts to click. And you know, they'll go home and say to their husband or their wife, like, I got a dental health scan. They're like, well, my office doesn't do that.
Yeah.
So that just shows you that our company is really up to date with technology, and we want to make sure we're providing the best for our patients.
Right.
So I think this does give us an upper hand when it comes to really showing the patients that we're doing everything that we can for them, and trying to educate them in the proper way.
Right. And this just goes to show you too. So Katie, I mean, our offices are individually owned. They're owned by the dentist. So, I mean, you know, Aspen comes out with, you know, these new technologies, but, you know, it is truly the dentist who owns that practice, either their choice to do it, or to, you know, buy the products that need to be. So just saying that all of our offices are eventually going to have the iTero machine, but again, each one is individually owned. So they are owned by the dentist, and they have the ultimate say. So Katie, what other services do you perform as a hygienist there? What else do you offer, or what other adjuncts other than scalings and cleanings?
So our office is really big on Zoom. So we really like to educate, you know, about bleachings. You know, obviously it's cosmetic kind of thing, but also we get the patients that are coming in for dentures that they want to have that pretty white smile to match with their partials or something. So making patients feel beautiful or handsome, you know, depending on if they're a man or a woman. But so we offer bleachings. Obviously the price differs by area, so we go over that. But my biggest thing lately that I've really become heartfelt about is oral cancer screenings. So we have the Velscope. I know that in different areas they're using different things. So depending on which office, you might have a Visalite, you might have the Oral ID, which are all doing the same thing. But I have honestly never felt the way I do about it now. Now that we have it and I'm using it and I'm actually detecting different things, it's amazing. And I'm actually getting so much feedback with the patients now. I'm getting patients that, you know, they're like, oh, you know, what do I need this for? And I'm like, well, because we want to check this. We want to make sure that there's nothing going on. And then I get patients that will say, I have a friend that, you know, was just diagnosed, and I know someone that they were only 17 and they were diagnosed, you know, and patients are starting to understand that this is very important.
Yeah, it is. So what about, this is another question that students always ask. So students are very big into community dental health and giving back to the community. Can you talk a little bit about the programs that Aspen has that are community oriented? It's either one, Rena or Katie, you can answer this.
Sure.
So,
Sorry, go ahead. No, go ahead, Katie.
I was going to say, our office does typically once a year day of service, and I've participated pretty much every year that I've been there, and it's great. Any kind of veteran can come in. and sign up, and we do their exam for free. And typically they get something that's really bothering them, if it's an extraction or a filling or even a cleaning, like an SRP or something that we can do that day for them. It's all for free. And then we get to pick one case at the end of the day that we do their whole entire treatment plan for free. So it's really rewarding.
Yeah, I love day of service. Ren, anything else that you want to talk about with
I
that?
do too, and I always get so emotional when they do give the free one, because it's
Yes,
always
I
like
know.
someone that's just like in tears, and you're like, yes, that's exactly why we do
Right.
it. I had joined. You're gonna correct me on the name here, but it was like basically an Aspen on wheels that we did. That's the way I remember. The
Yeah.
mobile mouth mobile.
Uh,
Yeah. So basically it came to Allentown, Pennsylvania for us, and I joined on it. And it was absolutely amazing. Like, to think that we went into like Center City, Allentown, we parked it there, and we had kind of like an open, similar to what Katie just said, free dental treatment for our patients that came into the bus, and that we were able to help them, either if they were disabled or veterans or whatever it may be that they were coming on the bus. And it was a bus that basically carried, 3 dental chairs inside of it, an x-ray unit. And what it was is it was able for us to see the patient on there. There was like a check-in station. It was very organized for just this
yeah.
bus that rolled through, and it just showed that they're going from state to state, basically just going out there and trying to help as much as people as possible. And there's usually, I mean, pre-COVID, obviously, we would go into some international country and ask for volunteers to come in. Usually it was like third world countries. We were able to go in and help people that were in need. I know they went into a few in the past where I had my hygienist actually go out there with them, and they definitely said it was moving and probably the best experience they had, to see the way that other people were living and what we could give back to them.
Great. Yeah, that's always nice. I love that that Aspen does that. Let's go back to clinical hygiene, Katie, and your treatment plan. Do you have full autonomy to treatment plan your patients, and how does that handoff with the doctor? How does that conversation go when you discuss a patient's dental hygiene?
So doctors are the final say, but hygienists in Aspen have pretty much the way that we would like to treatment plan. So you would never do, a Profuse on a scaling and root planing patient, or vice versa or anything. I have a great friendship and, everything with my doctor. So we talked about the patient, whether it be in the room or a handoff, letting them know, this is what I visibly see clinically, and then they will discuss with me what they see, and we make up a treatment plan for the patient from what we both think.
Great. Rena, hours. Work-life balance is a big thing for us. And so, there have been over the years, and part of the reason, again, you get on job forums and you read about Aspen or whatever, and some of the complaints were too long of hours, which I honestly didn't feel that way. However, we are about access to care. So we do have extended hours. And again, this goes back to the dentist has, kind of control over the days and times, but give a general schedule. Like, what are our hours, and what's a, full-time hygienist, what's that look like?
So a full-time hygienist is anywhere between 32 and 40 hours. So I'm sure this question will probably come up later on, but we try to get our hygienists to full-time because we just have so many great benefits that go with that, between holiday pay and vacation pay and 401k and all those great stuff that come with it. So it is anywhere between 32 and 40 hours. So one thing that we really try to stick with is it depends on the area. So for my area, let's just say where I was working, this practice owner in general, it's 40 hours no matter where you go, right?
Yeah.
It's not going to exceed the 40 hours. So you may have one longer day, but you're leaving earlier on a different day. So it all balances its way out. So basically in this particular office, it was 8 to 5:30, Monday and Tuesdays. It was Wednesday, 7:30 to 5:30. So just a half hour earlier. And then Thursday was our later day. So one day a week, typically in every Aspen office, we will try to open extended hours for the patient. You're still only working, you know, average
Right.
hours, but it's just you start a little later and you end a little later. But that one was 9 to 7. And when they work that 9 to 7, that way Friday morning, they only go in from 8 to 1.
Yeah.
And I was in love with that because I would take a 1 o'clock Friday any day than a 5 o'clock Friday in my
Yeah.
particular area. So I always say to the hygienist, there's two misconceptions. One, we make them, you know, you work all these hours and it's like a sweat mill of patient after patient after patient after
Right.
patient. And when they see your schedule, they're like, okay, this is not anything. You have an hour for the patients. You have 8 to 9 to 10 people maybe a day, depending on what it is, and you're working the 40 hours. So it's
Yeah.
nothing that's crazy. It's
Yeah.
exactly in line and normal with every other office. It's just if you work an hour later one day, you're only getting an hour early out the hour early the following day.
Right. So again, kind of going off of that, a lot of hygienists that I speak to or that I hear from on job boards are, they're getting sent home early if they don't have a patient, or, they have to clock out, or they get paid at a lower rate. How does that work at Aspen?
Can I take that one too?
Yeah, you can.
Yeah,
Go
okay.
ahead. I
So
wasn't
that's
sure Katie was back.
Oh, no, that security, security, security. I say this all the time. Just like Katie just said in the beginning of the call, she was working, 4 different offices 5 days a week, or 5 different offices, she said 5 days a week. And this is huge. Like, to find one office that's able to offer you your hours is so hard to find, the consistency and the security of that. You're not going to have a dentist that says, you know what, I'm going on vacation, we're going to shut the office down, and all of a sudden you're out of hours. You're not going to have a dentist that's semi-retired and coming in whenever he wants, any of that stuff. You're having security in your full-time job. No matter if you want 4 days a week or you want 5 days a week, those consistent hours are crucial. So we're not going to say, hey, Susie, we're done for the day at 8 o'clock. Sorry, you're gonna have to punch out and miss out for the day. There's so much opportunity still there. And as we're having these new patients, we're getting these new patients to say, so we're building your schedule as we go. So that's huge. It's just knowing that, you're not all of a sudden gonna get full-time to part-time to 1 day a week. It's that security of that.
Right. And that's what I love too is, I may have in Indiana, Pennsylvania, we sometimes weren't always as busy. And so I would go into 1 or 2 patients and that was it in my schedule. However, we had all these new patients and I was able to say, come on, let's treat you today. And that's so important when someone has active infection, to be able to give them that option to treat them if you can. And the kind of that leaves that space open so that if that does happen, sometimes your best days are days where it kind of fell apart, and then it ends up being like one of your best days. So that's a great thing. So we'll talk about COVID because, of course, we're still in the midst of that. So, Katie, first of all, this is a 2-part question. Do you feel safe in your office?
Absolutely.
And good, perfect. And how has your patient appointment changed during COVID? What do you guys do differently?
So we have extra time. Our patients' appointments have been, added a little bit of time to them so that we have the proper amount to sterilize all of our instruments, clean the rooms, change out of our PPE, everything that we need to do to make sure that from one patient to the next, we keep the patient safe as well as ourselves.
Great. So when a new patient, or not a new patient, when a patient comes in the office, is there anything different that they have to do at the front?
Absolutely. Now every patient that we see, they are getting a COVID screening. So they're getting their temperature checked. They are answering questions so that we know if they've been to any kind of hot spots or if there's anything that they could have been exposed to. And then every time that they walk through the office, before we see them, they get their hands sanitized, as well as we have them rinse with hydrogen peroxide.
Perfect.
So
good. Let's go over real quick, Rena, the hiring process, because I know I have people ask me this all the time. We get this question. What do I do if I want to get a job there? Like what's my process and how does that go?
So we have an Aspen Dental website that you can go on and apply. And at that point, we have recruiters that are going to help us look at our job and manage our jobs, should I say, that are open. And once you apply there, they'll reach out to you and they'll set up a time that we are able to speak. Usually your hygiene managers are the ones that are going to be calling you, and they're going to get to know you and touch base with you and do more of like a screening type. So basically talking to you and talking the brief questions, going over a few things. And then once you come into the office for a face-to-face, you'll be meeting the territorial managers for hygiene as well as the regional managers as well, because although we're the hygiene piece, we want you to get to know your regional managers where they're going to help you with more HR things and things that are non-clinical. So we have an opportunity of both of us meeting as well as a doctor getting to meet you and you getting to see the office and the way it works. So it will start by you applying, and then someone will reach out to you and set up a time with us to really get to know us. And from there on, we'll schedule whatever works for you and whatever's working for us to get you in the office as soon as possible.
Good. Katie, how about CE? Does Aspen offer CE?
Yes. So actually, this whole COVID thing, Aspen has been my godsend. They have provided us with so many different options for CE, giving us websites that we can go to, actually doing ones themselves. So like I just did one the other day from Philips on whitening, and I would have never found that. Aspen found that for me. Also, they have their own CE launches. I believe it's called Viva Learning, that they offer you, so that you could do it, at your own pace, at your own times. But they fully give you all the different options that you need to get your CE credits in.
For free.
Right. Yeah, exactly.
Yes, for free.
That's the best part.
Yes.
I know. So, Rena, a lot of, and again, I deal with students a lot, but I'm still, passionate about hygiene in general. So I do speak to a lot of existing hygienists, and there's a lot of burnout going on, and people that come to me or have spoken to me about like, what else is out there? What can I do beyond the clinical hygiene chair eventually? So can you just explain a little bit about your role and what exactly it is and how you support, the hygienists?
Sure. So from the beginning, like you just said, once you apply to Aspen Dental, it's going to come to me. And what we're going to do is just talk about the job position, talk about what your wants and needs are, because we could talk about what our wants and needs are, but if it doesn't match up with yours, that's not something that's going to work for either one of us. So we understand you have your own, if it's different hours or different locations or whatever it may be, that's what we start on first. Another thing that we're going to be doing after that is we'll meet you in the office, we'll do the in-office interview with you. And then from there, we bring you on board and we set you up with an office that is going to be able to train you. And once they train you, then what's going to happen is we're going to take you from there and support you both clinically, and we're going to support you both, like I said, developing into your field and getting into your field and feeling comfortable. And then after there, hold on one second. I'm sorry, it's cutting out. Sorry. So
That's okay.
Katie, that happened to me. What just happened to you? From there are basically it's an ongoing support. It's an ongoing training. Anything that you have a question with clinically in the office, new or not new, we're there to support you. We're there to tell you, hey, these instruments might really work good for you. Hey, this product might really look really good for you. Hey, your schedule may need a little help here and there. Let me help you do that. And I have access to all the schedules from my end, so that way I can help you. It's basically just being a partnership. And, one thing, like I mentioned before with Aspen Dental, is your career can grow so much further if you want it to, other than the clinical chair. If you're joining because you want to be a clinical hygienist for the next 40 years, great, we can support that too. But if you, after a while, I know for myself, after 8 years, I wanted to stay in hygiene, but I wanted to know what else happened in hygiene, right? I wanted to see what else was out there. Is it the recruiting field? Is it, hygiene and HR? Is it, maybe it's not hygiene. Maybe it's a regional manager. Maybe it's something in Invisalign, whatever it is. we have so many different steps and so many different levels in the company. And it's just absolutely amazing that you have that opportunity. You know, you don't want to do clinical hygiene anymore, but you want to do something else. If it's a lateral move or a higher move, you know, we love hiring internal people, right? You know the company, you love the company, you devote yourself to the company. So getting into the door of the company is really opening the door to a lot of different opportunities. Katie's on this call right now, and Katie is my bench right now. So we're developing her and training her because she's looking to pursue her career further than the clinical chair. So this is stuff that, you know, outside of Aspen, I know myself, I never graduated with a bachelor's degree. I graduated with a hygiene associate's degree. And I know if I wanted to take that degree outside of Aspen and want to look for a territorial manager position, or, you know, my next step is a director position or whatever it may be, I would never get there. So how amazing that this company is taking a chance on me, not only supplying me with years of clinical experience, but on top of it, having that advancement in career.
Exactly. And, you know, this is going to lead up to my next question, but me too. You know, I went to a 2-year hygiene program. I got my associate's degree, but I had 20 years of experience. And when I applied for this job, I'm like, listen, I don't have a bachelor's degree, but I have this. And they're like, that is more important. Plus, you know Aspen, you love Aspen, and, you know, we want to get you out there. So this leads up to my next question that people say, and this is part of the reason why someone had asked me, if you love Aspen, like the clinical part of it so much, it was the best job you ever had, why did you leave the clinical to go to this job? And it was because of this bad press. Okay. How do we handle bad press? How do we talk to other people when they say to us, oh my gosh, I heard this terrible stuff, or you see all this stuff online? And this was my main reason for leaving clinical hygiene and coming to this academic role, was because I went to this job that I loved, and it was exactly the way I thought dentistry should be done, the way the hygiene should be, the way that you're taught in school, and the AAP guidelines, everything. And I heard all these bad things, and I'm like, why is this happening? I need to talk to people. I need to find a way to tell people that don't listen to what other people say. And magically this job came available that said, hey, you get to talk to hygiene students before they're jaded, before people get in their ear and start telling them things that are untrue, because I've lived it. And that's why I took the job. So how do you guys deal with, you know, negative press? I mean, you know, with the hygienists that say, oh, you work for Aspen, or, oh, I would never go there because it's this and it's this.
Honestly, I can tell you that in school, even our own teachers were like, do not go work for a corporate dentistry. And it was the best decision I ever made. I honestly tell people, like, until you go and try it, you're never going to understand, because it truly, like you said, is exactly how it was in school. When I did private practice, I was doing so many prophies all day long that my hand was exhausted because they were not prophies. They weren't getting the correct treatment. They weren't getting what they truly needed. And Aspen has allowed me to correctly dictate the treatment that these patients need and give them the time and my undivided attention to tell them everything and give them the education that they need so that they can have a healthier lifestyle. So I tell people all the time that knock it, until you try it and you go for it, you'll never understand.
Right. Anna?
And just to add to Katie, I think that a lot of our slack that we get is things that go a lot deeper, right? If everyone had a good experience and went online and wrote about a good experience, we wouldn't have this conversation, right? It's only those bad experiences. I don't care if it's a restaurant or a nail salon or whatever you do, they're going to write the bad stuff, right? So I think a lot of it is just understanding why behind it. So a lot of time you read that, oh, I've been going to a dental office for every 6 months, and I showed up to Aspen Dental and they charged me $2,000. Oh, their price. And it goes so much deeper. And I know who's on now or who's going to listen to this call is going to understand that everything is not cookie cutter. Not everything is a prophy. A prophy is technically just light debris and a quick polish, right? If you're using your Cavitron or you're using something, that's not a prophy anymore. That goes on to the next step. And patients aren't going to understand that. And we don't expect them to understand it, right? We don't walk into a specialist, a cardiologist, and expect to know everything about the heart. That's their field and this is ours. And one thing that we do not settle for is we do not settle for just making the patient, oh, you got to pay, you have a cleaning every 6 months, sure, we'll just do that. But when we look at that x-ray and we see subgingival tartar and we see bleeding, we see inflammation, we got to do things that are going to make us sleep well at night. And it's unfortunate because their old dentist didn't tell them that we look like the bad guys. But that's okay,
Right.
because that's only training us to have those conversations, those hard conversations. And we know that in the end of the day, if they accept treatment or they don't accept treatment, that we did the right thing. And if we're
Yeah.
going to get smashed and bashed for that, then, you know, that's unfortunate. But until the
Yeah.
hygienists come on board and they see that and they want and that willing to just help our patients and do the right thing, then we're not money hungry. We're not trying to sell
Yeah.
dentistry. We're just trying to do the right thing.
Yeah.
And, you know, if past dentists of yours never educated you on that, we're going to be the first one to educate you on it.
Yeah. Exactly. And that's why I love new grads, because they already know, you know, they're taught that way and they're used to that way in school, and you lose that over the years. You know, you start to undertreat patients. I think undertreatment of patients is one of the worst things that you can do. And unfortunately, it gets done a lot. So by the time they come to an Aspen, they've been undertreated for years. Not everybody, you know, I certainly never put down private practice. There's a million wonderful ones, but a lot from my experience have been undertreated for years. And so they come to us, and I always tell students, you have to understand the type of patient that we have. I mean, generally, what type of patient do we see on a regular basis? I mean, Katie, what type of patient do you see?
So honestly, your new patients are the patients that haven't been seen for a long period of time. It's been 15, 20 years since their last cleaning, and they're coming thinking that they want all their teeth pulled out, is what I typically get.
Yeah.
And we're like, no, you don't want that. You want to keep your teeth. And those are your perio patients that you can educate and make sure that they understand the importance of keeping the teeth that they need to keep. And going from there. But typically your new patient appointments are patients that haven't had any kind of dental care in a long time.
And so when I explain that to students and I tell them this is the type of patient, because they know this type of patient, and they go, oh, that makes sense. Those are the ones complaining, the ones that, you know, haven't been there for a long time and, you know, expect that after 20 years. I used to tell patients all the time, a prophy is a preventive service. If you went to your doctor to have a cancer screening, that's preventive. Now they tell you have cancer and you say, oh no, I just want to keep having screenings. I don't want to treat the cancer. I just want to keep having screenings. That's basically what, when you have periodontal disease and you say, no, I just want to keep having prophies, that's basically what you're saying. And when I say that to patients, because now we're doing the AAP guidelines, which is staging and grading, basically like cancers, they get it. It kind of snaps in their head like, oh, well, that kind of makes sense. So yeah. So, and I also listen, I always tell these students, sometimes it starts with you. If you're going to not help out in the office, you're probably going to have people that don't help you. You know, sometimes it starts with you. If you have a bad attitude, that's going to portray. You have to be a team player. We're about being a team in this, in Aspen. You know, so give a little background, run it real quick on the culture. We always talk about the culture of Aspen, and what does that mean?
We bleed blue, right? That's what we always
Mhm.
say. So I honestly, if it wasn't for this panelist or it was my position when I talk to new students all the time, I say this honestly from the bottom of my heart, is I love this company. I really, honestly, I truly do. And I don't know when I adapted that culture and that behavior, but it's something that you will have. And it's kind of like your baby, you're protecting it, right? Like when you
Mhm.
hear those people make those comments, you're like, no, it's not what's going on. And you kind of want to just shake them. But we're about culture. We're about, you know, we see our work family more than we see our family at home. Right?
Right.
So why be miserable? I can tell you, as a clinician over the 8 years, I got to know so many different offices. You know, they were the same actual owner, but I moved and helped develop each office before I got this position. And I had so many good memories and funny memories that I can think of from 8 years ago. And we keep in contact with each other. And, you know, it developed who I was as a hygienist. And I think the culture behind Aspen is just basically making sure that we're breaking down those barriers for our patient. We're having that access of care to our patient. You know, we're treating each patient like they are our mother. We're doing all the things that we would want and live by, at the same time running a great dental practice, and making sure that we're not only there for each other as a family and as coworkers, but to our patients. And it's hard to describe, but you'll see everybody in our family wearing Aspen Dental swag. Yeah, there you go. Aspen Dental swag, really just representing where we work, and I'll say it loud and proud any day. So I think that's what the culture is for me.
Yeah. So I want to be respectful of your time. We're getting down to 5 minutes. This went quick because it was so great. I love talking to you guys. So is there anything else real quick that we didn't get to that you may want to just put out there before I ask my last question? Anything that we didn't cover that you might want to?
I think my parting words is just, we understand where you are right now as a new grad. If you're a new grad or coming from job to job, we've all been there. We've all, this is a really scary time right now, and it's different for everybody. And you're going into the field where, people that are veteran are leaving the field, and we rely on you to help us help our patients. And we're with you each step of the way. And I always remind that to my hygienist. The communication will be there. You'll never feel alone. You'll always feel supported, no matter how big you think this quote unquote corporate or DSO world is. You have more support joining a family like Aspen Dental than you will in any other office.
Absolutely, 100%. So my last question to you guys, and parting words, is we say that we are a yes company. Okay, we say this is a yes company. What does that mean to you, and how has that impacted your career? Katie, you want to go first?
I'll let Renee go first.
Okay.
Okay. So our yes mentality is just basically whatever the challenge is, whatever it's going to throw to us, we want to make sure that, yes, we're going to help you. Yes, we can stay, one day later in the day to help you out. Yes, we're going to be able to get you those dentures to make you smiling again. Yes, we're going to take that disease from you. All the things that you want to hear to get you to a really good place. So the yes mentality is just being positive for me. Just looking, imagine if it was a no mentality, it wouldn't sound so pretty. So our yes mentality basically is just making sure the patients know that we're here for them. And that's our first priority.
Good. Perfect. Katie,
Sorry.
there you are.
Yes, okay. Here I am. Yes. So yes. But I completely agree with Brenna. Sorry, I had to pull away for a second, but
that's okay.
It's just making sure that, anything the patients want, we can achieve it no matter what. So if I am honestly not the only one to do this, I've seen it in all of the different offices that I've worked in, going the extra mile to make sure that the patients are happy whenever they leave. If it means that my last new patient of the day is a scaling and they can do it today and they can't do it again for, however long you wanted to get it in today, then you stay, you do it.
Yeah.
Or if, the office manager is the one doing the consultation and it's a hardship with money and, that's hard for a patient, it's getting a way and figuring out that way so that we can have the patients say yes. We can get them to the point that they are happy. So
good. This part always makes me feel good. So for me, my final words, what yes means to me is I was very burned out with my career. I lost my love for hygiene, and I walked into Aspen and it completely renewed that. And my goal was to spread that word because I love this company and I believe in our mission 100%. And so I appreciate your time, guys. Thank you so much. You guys were great, and I hope to work with you again.
Thank you.
Thank you. Have a good night.
Thanks for having us on.
Oh, yes. Bye-bye.
Bye.